Atrial fibrillation is a cardiac arrhythmia in which the upper chambers of the heart, the atria, get completely out of rhythm. It's a common medical condition. It's more common as people get older, and it decreases the quality of life by causing palpitations, general malaise, decreased energy, and shortness of breath. When people have atrial fibrillation, they usually come in two varieties. When people have what we call paroxysmal atrial fibrillation, that is atrial fibrillation that terminates by itself, the most common symptom tends to be palpitations, that is becoming aware that the heart is beating fast and irregular. Now, it can also create a lot of shortness of breath, particularly on exertion, that is shortness of breath when the patient goes about doing physical activity. For older patients and patients that have more persistent atrial fibrillation, that is atrial fibrillation that does not terminate by itself, it is common to have general malaise, easy fatigability, just a sensation of overall decreased well-being without necessarily having an awareness that the heart is indeed out of rhythm.
My family doctor noticed that I had an irregular heartbeat. I didn't have any symptoms, so I went to a cardiologist and they ran some tests, and it was irregular heartbeat. It wasn't just off and on, it was irregular all the time, which was concerning. And the cardiologist sent me to Dr. Natali to discuss his procedure. The possibility of a stroke was very concerning to me, so I opted for the procedure immediately, and we scheduled a procedure, which we did that the first week in December of last year, 2009. And what is it now, 9 months, and it's still in rhythm. Maybe there are a few things that I seem to do better now. I worked hard then and I work hard now, but I'm sure that physically I probably am stronger than I realized. All in all, I think I'm in rhythm, and the old ticker's working pretty good.
A catheter ablation procedure for the treatment of atrial fibrillation is a good option for patients that have a paroxysmal atrial fibrillation who have an otherwise normal heart. It can work as much as 85% of the time with one catheter ablation procedure. If we do it a second time, the chances that the patient will end up with persistent sinus rhythm is better than 95%. Atrial fibrillation does not have the recognition in the community that, for instance, chest pain, as it relates to coronary artery disease and the possibility of having a heart attack. Atrial fibrillation, however, is directly responsible for about a third of all the strokes that happen in our society. Texas Cardiac Arrhythmia, we have been very prominent in the use of catheter ablation techniques for the treatment of atrial fibrillation that to many patients can be a life-changing experience.